Hi guys, it's Nicole from the Physio Crew and I'm doing a quick video over my lunch for how we feel pain. So there's lots of myths about pain and I bust those, and it's very difficult to go into a 5-minute video to tell you all about pain. Is too difficult. So I'm going to just give you the top 3 ways we feel pain. So the first thing to say is that pain is all in the brain, absolutely in the brain. If you chop your head off, you can't feel pain. If you chop the limb off, you can feel pain in the hand or the leg that's not there anymore. So we know that pain is felt within the brain. And what we're actually receiving from different areas of our body is something called nociceptive signals. So what that is it's giving the brain sensory information, and then the brain decides whether it's dangerous or not. So the different ways that we receive nociception, so this information to the brain, is we can feel temperature, so we can feel if it's hot or cold. We can feel pressure, so if someone's pushing your finger or your nail bed, that's sending a signal to the brain, so we can feel pressure. And we can feel chemicals, so chemicals are things like inflammation. So all of that information is sent to the spinal cord. The spinal cord gets a bit of a decision whether it sends it up to the brain or not, and then all of that information is in the brain, and then the brain uses its past experience to work out how the pain experience will feel. So for example, if you get stung by a bee, sensory information, so you're going to have chemical information, going to go up to the brain. The brain's going to say, okay, you know, black and white, little fuzzy wings, makes a zzz sound, and it's going to give you a little bit of pain to teach you to stay away from bees in the future. If the first time you have a bee sting, you go into an anaphylactic shock and you almost die, the next time the bee comes along, coming along, the brain says, okay, little buzzy thing, it's got black and white, it flies. It's going to be exactly the same information going up to the brain, and the brain says, right, what does this specific information, what does it mean to me? It thinks back into its past memory and it says, that thing almost killed you. Excruciating pain the second time, absolutely massive. So pain is an experience within the brain, it's a learned response, and you can learn pain. So for example, if that bee kept stinging you over and over and over again for 4 to 6 months, what would start to happen is your brain would become very sensitive to bees. The bee could be in the room and you could hear it, and you could start to increase your heart rate, you could start to sweat, you could start to be very, very anxious. If it landed on you, you might feel pain even if it didn't sting you. And so a lot of the times people are like, well, how does physio like tie in with the brain? But the brain is everything, and that's why it's really important to come to somebody who actually understands about the brain. So we're not just treating the symptom. Of course we do that, of course we look at the injury and we treat the structures, but we also look at that pathway up to the brain. What is the signal coming up to the brain? What is the dampening effect coming down from the brain? How can we change pain? Because at the end of the day, when people come to see me, I always ask people, what are your goals? What do you want to get out of physio? And you know what they tell me all the time? Get rid of pain and get back to the things that I love. So get rid of pain. Now, if we only treat the structure and we don't think about the brain and the pathways up, we're never going to be as effective. So when you come into the Physio Crew, you know that you're going to get education on all of those things. Of course, we're going to treat the structure as well. We're going to do hands-on, we're going to get you moving, we're going to do exercises, we're going to do everything in our power to stop you getting re-injured and to stop the pain coming back in long term. We're much more about the long game. We're not interested in giving you a quick win and then it coming back in a few weeks' time, or making the pain go away for 2 or 3 days and then you've got to pay us another, 40 quid the next week. We're not about that. We're about making sure that we treat you holistically. We want to make sure that you don't have a fall in 6 months' time and then have a hip fracture. What's the point of coming in and spending money? You may spend 100, 150 pounds. With us, if you, for example, if you have a hip surgery or you've got a very painful hip, I would much rather get you to come and spend an extra £80, say 2 sessions, and make sure that you don't then have a fall in 6 months' time where you fracture your hip, which then costs you, 30% mortality rate within a year if you have a hip fracture, or it keeps you, if you're a younger person, it might keep you off work, it might cause you lots of pain, you might get chest infections. So you've got to think about things in a big picture, and that's what we do in the Physio Crew. We don't just say, right, we're just going to patch it up. If that's what you want, if you say to us, I've got X amount of money and that's all I can afford, and I just want to come in and spend £80 and that's all I can afford, we will do that. We'll give you the best possible service that we can for that particular price. But if you want honesty, if you want someone to say, actually, it is going to be a little bit longer, but it's going to help to reduce your risk of this. I mean, the same with ACLs. You know, people always, they're very frightened of getting an ACL, that's a ligament tear in their knee. Now, we know if you don't rehab that well, your risk of re-rupture is quite high if you don't rehab it. So as a clinician, I'm not going to say to you, you've got a really good chance of not getting an injury if you have 2 sessions, because it's not the truth. Like, I don't do that. I'm very, very honest. And that's what we want. We want people to come and see us who are motivated. We can help motivate you if you're not feeling that motivated at the moment, but we want people who understand that change takes a transformation in what you're doing. You can't, if you want to lose weight, you can't just eat the same thing and not do any exercise. Like, you have to have changes, and it's the same within physio. But what's amazing is you can get really, really good results, and I hope you're getting to see some of those with Facebook Lives and physiotherapy. It's very difficult for me to give you patient analogies. I can't, confidentiality wise, I can't tell you I've seen this patient and this is the result. I try and give you examples and change a few of the details, like their age and things, so that it doesn't breach any confidentiality. But go on our website, look at the testimonials that people have given us. We've got 346 testimonials. Like, show me a clinic in Bristol and Barnstable that has 346 people who are saying, this clinic is amazing, they've helped me, they've got better. And I want to shout from the rooftops what I think. I want you to read what they've said and see how they've progressed, because so many people are living in suboptimal health and fitness, and there's just so many things that you can do yourself and with the help of professionals to get you better, and just people don't know about them. So that's why I'm telling you. All right then, guys, have an amazing day. Take care. Bye bye.